Good by me.
Okay.
Okay, we're live.
All right. Thank you, Larry. Good morning, everyone. It is 8:03 a.m. We are here for a Board of Health meeting. Just a reminder, we're on Zoom, we're live. People might connect via phone. And so this is Deanna Diamore, Director of Health for the City of Norwalk. So if you're speaking, just as a reminder, please say your name so that everyone knows. I see we have 3 attendees, and Diane Lauricella is one of them. She has her hand up, so I'm assuming that means she wants to speak. But let's start off. It's 8:03, call the meeting to order. Let's see who's here. We have Norman Weinberger, Board of Health member, Terry Quell, Board of Health member, Ken Lalim, Board of Health member, and Janet Karpiak, Board of Health member. And on staff, we have myself, Megan DeMeglio, and Teresa Argandesi. So I would like to start off with approval of the June 23rd, 2020 meeting minutes. Do I have a motion?
Moved.
Do I have a second?
Second, Ken Lalim.
Any comments, edits? All in favor?
Aye.
Aye.
Thank you, everyone. So our next item on the agenda is public participation. Diane, did you want to speak?
Yes, good morning.
Good morning.
Good morning.
For the record, my name is Diane Lauricella, sweltering here in good old Norwalk, like everyone else. I look forward to the agenda items, and I just wanted to offer an idea related to COVID-19 before you all get started in your deliberations today. I was speaking with some friends about the different kinds of PPE and a lot of the discussions at every level of government, especially from the White House, about the use of a mask or not, and when to use them and how to use them. And I think some friends of mine in Norwalk and other towns are kind of weary after almost 4 months of trying to help in our public health crisis by distancing, social distancing or physical distancing, which I like better, washing hands, and then of course wearing some kind of face covering. And I know I've spoken with Deanna about, and Teresa about the possibility of being creative and getting the messaging out. And so I just would be interested during the COVID discussion to see what kinds of messaging ideas are going to be put together related to reiterating in creative ways why and how face masks and face coverings are important, and not give them a lot of the science, get in the weeds of it. But I find when I was a health and safety coordinator that when I was trying to teach people about using the PPE, sometimes giving a message about why and a little bit about how it works is helpful, because then it's just not government telling us what to do. And of course, there's many people are just getting weary and exhausted. So, and I want to tell you that I'm happy to write letters of support and get others that care about this to write letters of support, Deanna and the board, if you need more money from the city and the taxpayers to do this, even to hire some time on television, or there are a lot of free ways to get the messaging across. But I know this is the major campaign. It's a major crisis still, and I know we've done so well in Norwalk, and I appreciate all the work the staff has done in the Board of Health and the mayors and the mayor's staff. However, we have to look at non-traditional ways to get messaging out in this case, because people are exhausted hearing about face masks, and those that started out wearing them incorrectly are going to continue doing that. As you all know, you see people putting them around their neck or just around their mouth, not their nose. And of course, we've learned a lot more about how this particular virus spreads. So I would like to hear some words come out of the mouth of this council, the mayor, and you all about the aerosolized COVID. There are just these 10-second sound bites on news programs that a lot of people don't watch anymore on TV, that when people speak or they sing, the droplets become aerosol. And I think the public needs to understand that in order to protect themselves. Lastly, I just wanted to say there is mixed science about the issue of eye protection. And it is considered still one of the pathways for the material, the virus, to shed. Possibly, it's apparently less so than through the mouth. So I'd just like to hear a little more detail in the public realm, and I'd love to hear what the plans are. Also, lastly, I offered to help with suggestions about how to help people understand the different types of face masks. So if all of you would go to the Norwalk Hour, even those that don't have a subscription, I'm sure the city would be allowed to look up the April 26th Norwalk Hour Sunday front page Hearst article and terrific graphic about the different types. It needs updating. I've requested that they do some update, but I'm not sure that will work. So with that, I thank you, stay cool, and I'm so happy to help us stay safe.
Thank you very much, Diane.
There is one more person that's attending with area code 508. They're dialing in. If you'd like to speak, hit *9 on your phone and that will raise your hand electronically. All right, I don't see anyone else that would like to speak at this moment.
Okay, thank you, Larry. So the second item, or third item on our agenda is the director's report. I wanted to give everyone a quick update on, our racism and health discussion last time. We did have a staff meeting a couple of weeks ago, and we brought up the topic, and we said, we wanted to engage staff in those discussions and that work as you guys had advised us. And so Megan has been compiling a list of staff that are interested. So we have a small work group of staff that are interested in working on this. And so Megan, do you have anything to add on about that?
It looks like there's about 8 people that are interested, so I'm excited for that. And then we're going to be looking to use some resources from national organizations on this.
So thank you, Megan. So I'm glad to have that interest. And so we'll have more to report in the months to come, but we did, talk about it at a staff meeting. People are interested, and so we're happy about that. So thank you for your guidance on that. I think it is really important that we engage the staff in the work, and so that we get buy-in at all levels for this important work. I also wanted to give you an update on flu. Teresa and Megan and Pat and Glenn and Darlene and other staff have been working on planning for flu vaccination for the fall. And so we're continuing to move that work forward. And we're also going to be having a meeting with some of our community partners, the hospital, the community health centers, and others, just to talk about strategy for community flu vaccination, just to make sure, trying to figure out what are the strategies of other entities and making sure there are no gaps in the community, and so that we can make sure that we are able to provide vaccine in a new way, because we're in the middle of a pandemic, so we're going to have to deliver vaccine in a different way. But looking forward to that meeting and seeing what everyone is planning on doing and how we can support each other. So I think that's really great. Teresa forwarded us an article. I can send it to all of you about what's going on in the Southern Hemisphere right now with flu. They're finding low flu counts, but they're also in the middle of all these aggressive measures to protect the community, staying at home, the face masks. But I'm hopeful that, you know, some of these measures that we're employing for COVID will also keep our flu numbers low, but we don't know what's going to happen. But so we have to make sure that we're staying on top of this and make sure we're vaccinating as many people as possible. We anticipate that we're going to have a lot of interest this season for flu vaccination. So that's my brief director's report. Teresa, anything to add on flu? No, okay. So the next item is about COVID-19 updates and discussions. So a lot has happened within the past month, both nationally and statewide related to COVID. Within Norwalk, we continue to see low case counts. We're following it, we're tracking it, looking at it by week, by day. We are seeing a delay in reports and lab results, and that's a nationwide problem right now because of the high demand for getting tests. And so last week, Connecticut added several new cases that were a result of delayed reporting from one out-of-state lab. But then we also are seeing, you know, depending on if you're symptomatic or asymptomatic, your test results may come back at a different time, depending on which lab you're using. So that's one issue that we're facing right now, is that now the rest of the country, you know, there's such a high demand for these tests. Anything to add about tests? Any discussion you guys want to have around tests? We also, you know, with the universities coming back, we know there's going to be that demand as well for testing.
Are you partnering with both health centers on that, on testing?
So Day Street Community Health Center is part of, you know, Community Health Centers, Inc. They are doing testing Monday through Friday at their center, and they're also going out and doing some locations within the community. Norwalk Community Health Center, so we meet with them every week and we give updates on COVID-19. They had been partnering with the hospital for their testing, and they're also going to be they're also testing their own patients at this time. So I don't believe they have. So yeah, we're working closely with both community health centers. We're in contact with them on the testing. And we're also trying to think about with flu season, what does that look like too with testing, and will we be able to test and swab for both flu and COVID at the same time? So yeah, so every week we meet with the hospital and the community health centers and other community partners to strategize and how we can work together, both on, you know, strategy, but also messaging and communication and keeping each other updated on what's going on and how we can support each other. So yes.
That's certainly the populations that they treat are exactly who we need to make sure get access to this opportunities. I think Diane had some really good points on the educational side of this, that it's going to be here for a long time and people are getting tired of it. But you know, my message always ends up being, I got a 91-year-old mother and I'm wearing my mask to protect her. You know, and people forget that that's what you're really, you know, so she has a difficult time with masks. And I'm like, wow, it's more important. It's important that you wear one whenever you can, but it's a lot more important that anybody that walks into your space is covered. So I don't know if there's, you know, some messaging in there is you know, do it for your grandma. You know, it's like there's an ad campaign somewhere back there that says, do it for others. If you don't want to do it for yourself, do it for somebody else. But it's true, and she has a real hard time with it, so she always wears it down below. And I'm like, Mom, that's not really helping. She goes, I hate it up near my eyes. And so it's hard to train or teach some people to do that. But if we can generate the buzz around who, you know, protect yourself and your loved ones, I don't know, maybe there's a message in there somewhere.
Absolutely. And we think about messaging too. It's very clear how important communications and health education is. I've always believed that, and it's even more important now. And we've been messaging all along, but you're right, like there is that fatigue for this, you know, but it's still here and it's not going anywhere. And so we need to constantly be thinking about how we can be delivering the message in a different way, and so it resonates with different people and different communities.
How do you change it from you have to you want to?
Mhm.
You know, telling somebody, you tell your kid, whatever, you tell people that they have to do it. Their first thing is to get their back up and say, I don't want to have to do that. You somehow make it such that it has a purpose and has an end result that's positive. I think people are more apt to adopt that. So I think it is definitely our role as educators to the public to make sure that the messages are getting out there in the right way.
What do you think of doing, like filming little blurbs of each of you giving a message about it, about masks, about, you know, anything related to COVID-19? And like we can compile it and put it on our Facebook page, like as Board of Health members, you know.
I'd be willing.
Go ahead.
No, that's all right. Go ahead.
I wouldn't mind that, but I'm thinking, especially with school getting back in session, could we maybe get some of the leaders in the schools, like the kids and the coaches, to do something? Because I know my daughter's a teacher and she's going back to school soon, and a lot of the teachers are very, very worried about this whole thing. So I'm wondering, you know, I'm more concerned about like the middle school and high school kids who, you know, they're not going to be in any big rush to be wearing their masks. So could we maybe get like, I don't know, high school, I don't know, class leaders or sports, which we're not going to have sports or whatever, to maybe do some kind of messaging? That might be really effective with the kids.
I think you're right, Teresa. I think peers giving out the message is pretty strong, and teacher leaders that the kids respect is pretty strong.
Mm-hmm.
And if we could get rid of the politics and just stick to the science, that would be strong.
Absolutely. Yeah. I mean, get the favorite science teacher at both of the high schools, or, you know, I'm sure there's somebody that would be willing to do that, or somebody who is like, I don't know, the coach of, you know, one of the teams that the kids are really respectful of, the band directors.
We can certainly talk to NPS about that. They've already started to do work around communications and messaging related to reopening. So we can talk to Dr. Estrella, we can talk to Brenda, we can, you know, talk about like a partnership related to that. Sounds like a great idea.
How about for the kids? How about like a mask contest? You know, who's got the coolest mask, or you know, who's got the most, the one that's patriotic? You know, they have 6 or 8 different categories of things that you could win prizes, Dunkin' Donuts or whatever. Some way of getting them involved with a proactive approach to, I wear this and this is cool, or whatever it might be. I don't know, just some way of getting it off the you have to, you know, because that's what that's resisted by everybody. We all do that, you know. So
That's
Yeah,
a really good idea.
there are a lot of cool face coverings out there that you can order. Yeah. Okay.
this is where science and graffiti meet, right?
All right, great. Thank you for these ideas. People can, you know, they can make their own too. You know?
Yeah, and if we can have the health department sponsor that kind of stuff, I think that gives us an image that's, you know, a bit more proactive and working with the community, not demanding. You know, every time you demand something of somebody, it just comes off wrong, you know. So you know,
Okay,
trying
great.
to make something out of this, because you're right, people are getting tired of this, and it's here for a long time. This isn't going away. You're going to run right into flu season. You're not going to know which one is which. You have to treat them all the same. You know, it's going to be tough.
Mm-hmm. Okay, great. Thank you. Teresa, do you have anything you want to add around messaging and communications? Any updates you want to give?
No, I think those were some great ideas. And a lot of times, you know, to your point of involving the school district, we do have to rely on our partners a lot of times to amplify that message and to reiterate it. So those are some great ideas.
So we're also following very closely what's going on in the other states related to COVID-19. I think they've been usually updating the list of states every Tuesday morning, so I'll have to check if they've updated it today, but I think there've been 31 states on that travel quarantine advisory from Governor Lamont and the other, nearby governors. So, and they're also, the commissioner signed a new order last week that strengthens some of the provisions around the quarantine. There's now a fine associated with it. If there's a violation, there's a lot more messaging, talking about messaging, at the airport. The state has done a lot, if you notice, some of the messages on the highway have changed. It doesn't say travel advisory anymore, it says travel quarantine. So they're getting a little stronger with the language. They've had, I think the governor in his update yesterday, I wrote it down, had over 5,000 travel health forms submitted. So if you've traveled to one of these states and you're coming back to Connecticut, or if you're just coming to Connecticut, you have to fill out a form. They've had over 1,800 inquiries to 211 and DPH about it. Teresa's also worked on some messaging related to it. One of the things that we've been asking about is the whole testing strategy related to it. So if you remember, it's a 14-day quarantine. Unless you're unable to quarantine, you can get a test 72 hours before you arrive that's negative. And if you're still waiting for the test results, as we know, they can take some time. You have to quarantine until you got that negative test. But a lot of health directors around the state have been asking, well, what does that mean, unable to quarantine? Because when people hear, well, I can just get a negative test and I don't have to quarantine, that's what they want to do. But unable to quarantine really is supposed to be for specific situations. Let's say someone has passed away and you are attending the funeral, and the funeral is happening at a certain time and day, and you can't quarantine for those 14 days. Or, it's really specific like that. And so I'd ask the question, well, what about returning to work? A lot of people will say, well, I can't quarantine because I need to go to work. And they don't classify that within the unable to quarantine. There's also some questions about, if I'm an essential worker in Connecticut, can I get a test rather than quarantine? But that essential worker travel provision is for people who are coming to Connecticut, or you're going to another state for work, not that you're traveling to another state for personal reasons, whatever they may be. So there's been some more clarification and messaging around that, around the quarantine. And the state is the one who's responsible for enforcing it. But there is a provision in there that says that the Commissioner of Health can authorize the local health director to enforce, if, basically it's there in case it's needed, in case there is need, if enforcement at the local level is needed. So that's where we are right now with the quarantine.
Where's the enforcement side of this?
The state health department. So it's the commissioner, but in terms of like on the local level, yeah. There's a way you can, I'm gonna pull up let me pull up the website right now. They have a frequently asked questions. Hold please. Larry, is it too late to share my screen? Am I still able to do that if I want to?
You should be able to.
Okay, so just so I can pull it up.
Yeah.
Can you all see the website? Can you see my screen?
Not yet. It's getting there. It's thinking.
It's thinking?
Yeah.
Spinning dials.
As it started.
It's yeah.
Oh, there we go.
You got it? Now. Okay. All right, so there's still 31 states. So there's this part about, they've created a channel to report any violation. If you see number 12 here, you can report violations to either 211 or email the DPH if you want to report a violation. So that's one way. I think a lot of it though is really around messaging and making people understand it, more than the enforcement side of it. If there's an egregious violation, there are ways to enforce it, but a lot of it is around the messaging and letting people know it's kind of like quarantine and isolation right now too, when you're a contact of somebody, or if you're sick and you need to isolate. A lot of times it's a call from the health department explaining it, that'll influence people's behaviors and getting them to understand the importance of it. Even people seem to say, they're like, well, I got a negative test, so I don't have it. Well, that it takes 2 to 14 days that you can become sick. Like not everyone even understands the incubation period and how you can come from a state with widespread community transmission, have a negative test, but you can come back and a few days later you can still become sick. And so a lot of it is around education. So I don't know if that really answers your question, Ken, but it's like with any enforcement, a lot of it is
about way. Anybody getting any penalties? Is there any, or can people just thumb their nose at this policy and say, I'm going to do what I'm going to want to do anyway? I'm going to work. The biggest one that we get is, I can't not work. I'll take my chances. Don't test me. I don't care how I feel. I'm going to work. And until somebody stops people from going to work on those kind of things, a lot of people are paid only when they work. And they want food on their table. And if they have that choice between food and a test, or self-quarantine, it's going to be difficult. I don't know how employers are we addressing employer issues so that they can be enforcers at the same time, but it's their livelihoods too. It's a difficult area.
It is. So the penalty is $1,000 for each violation. That's the civil penalty that the commissioner can enforce. But a lot of it.
Has that happened that we know of?
Not that I know of. I'm not aware of it happening at this point. It went into effect last week.
Mm-hmm.
So, some other updates. So the CDC updated their return from isolation criteria last week. And so they're finally saying that they don't recommend a test-based strategy. And Norman, I don't know if you want to add anything to that.
And ever-changing policies.
Yes, just when you have it memorized, then it changes. Yep.
Poor school district had it all laid out, and then this came in and they have to change everything.
Yeah. I think it's a good change though, but talk about communication, always having to constantly change those materials.
Have you had any input from the general public on that, on those changes?
So we spoke about this. It's really important to get people back to work because some employers wanted those 2 negative tests. And we've been finding that some people can test positive for over 30 days. It can take a while to get that negative test. So I think it's a really, people are a lot of the healthcare providers too are really happy about this change. So now they can point to the CDC guidelines have changed. This is something we've been saying for a while now. The state has been saying it. We've been saying it. You should be using the symptom-based strategy unless there's a particular situation where you would need the test-based strategy. But for the most part, that symptom-based strategy should apply. So this is really helpful to have that CDC guidelines. And they also explain in detail, the reasoning behind it as well. So that's been helpful. So, yeah.
I think the general public is aware of that.
So the mayor put it in his daily briefing yesterday. And we're also reaching out to the businesses too to make sure they're aware of it as well. I think it's the employers, but it's also like family members themselves. It can, it has a mental health toll on you if you keep testing positive for something and you can't get that negative test. Like you feel like you can't be around anybody. So there's that component as well. So we'll continue to keep.
To call the mayor's thing brief, by the way, I wish it was brief. I don't find it brief. It's if you go, I searched for what's different from yesterday, so the numbers get updated. I know that.
Yeah. He actually gets a lot of people appreciate getting the different updates every day. So like tries to keep some of the state updates, any national updates, and then anything local as well. Just
so much information out there. It's,
It's a
it's
lot.
that you want to become the trusted source, and be able to provide accurate and efficient information. That's us, I guess. So that's I'm glad we get our nose in there a little bit. So
Yeah. All right, so we continue to do enforcement. I just wanted to point that out. We've been sending sanitarians inspectors out on weekends, on evenings, just to stay on top of some of the businesses and making sure, we're making sure the establishments and everything are following the reopen guidelines, making sure the tables are apart, making sure, all those different measures are followed. Because we're seeing what's happening in some other states, in regards to bars and other, other things. So we're just really trying to stay on top of it as much as we can. It's definitely challenging for us, as with our staff. We're just doing what we can to be able to serve the community. But as you know, our department is doing a lot to support this. So keep on.
are we finding that most of the establishments are following the rules?
Yeah, most are, and most, they need the reminders every, once in a while, and they follow through. But yeah, most are. Yeah, and we'll get some complaints too, where someone will observe something while they're there, and by the time we get there, we don't see it. But we do have constant communication with the managers, and so they're aware of everything. I think again, the masks are probably the most challenging, right, for the public. For the most part, people get it and they're understanding, but people are the hardest thing to police, right, and their behaviors. Making sure again, so that's again where the education comes in. So those are most of my updates. Teresa, do you have anything to add? Megan, do you want to give a quick just update on contact tracing? Continuing to use the system.
Sure, yeah. So yeah, we're continuing to use the contact software system to align our work that we've been doing since March with what's going on at the state level. Megan has been hard at work recruiting and onboarding volunteers to help us get ready for a potential second wave in the fall. So we're really hoping that we can get some additional folks on board, get them acclimated to the system and to the process, so that if and when we see cases increase, and hopefully we prepare for something that that doesn't have as big an impact as we're preparing for. But as we see things increase, we'll have a good well-oiled machine going so that we can hit the ground running. Megan, anything to add? No.
I do want to mention thank you, Teresa, for that. From the funding side, we're still waiting to hear what type of funding we're going to get from the state for contact tracing. I'm hoping for an update soon. They had told us that they did allocate certain money that they had gotten from the CDC to local health departments and districts for contact tracing, but we're still waiting to hear about the particulars about that and when that's going to happen.
Are you employing people, or is this all volunteer still, or?
So a lot of health department staff, you're looking at two of them, Teresa and Megan, they're doing it. We had been utilizing the school nurses. They had been so amazing in helping us and volunteering their time, but they're working right now. And we're also working on onboarding volunteers as well. We had been putting it off because we had heard that we were going to get funding, but now we don't know when it's going to happen. So Megan, do you want to speak to some of that about the onboarding process for volunteers?
Yeah, so I'm kind of glad that we're able to do the onboarding now, so that I do have a little bit more time, because when we were in it, there was no time. I was doing a lot of contact tracing. So now I have a little bit more time to onboard volunteers. So we partnered with one of the universities, and they sent us a couple. We're looking for bilingual volunteers. Is a huge piece of this. So anybody who's Spanish speaking would really be a big help to this process. It has helped that I have been doing contact tracing. So when I'm doing the orientation for the folks, I know the work that they're going to be preparing to do. So, we're training them on HIPAA and confidentiality. We're then training them on using the actual system and the logistics of that. And then making sure that they're just aware, when you're doing the contact tracing, Teresa and me had a call yesterday, and there's always something that's different. Every case is not the same. So just making sure that the volunteers have all the resources they need for, when they start.
So how far do you go before you hand it off to the state? Or are you the state's representative for this area, and how do you determine what that area looks like?
So the state will take a case if we haven't started taking out, if we haven't started making contact with the person, if it's over 24 hours. So that happens, that'll happen to some cases on the weekends. If we're unable to get to that case, then the state will, one of their volunteers will take that case on for us.
With this great delay in return of the test results, how effective is tracing?
I know. So we've been saying that too as well. It's only as good as the surveillance system and as good as the lab tests come back in. We've had some cases where it's like a few days and then the case is done because it's taken a while for the lab results to come in.
And then just on the, back to education and communication, really important for folks, to know that if they are seeking a test because of symptoms, they should be isolating immediately and not waiting for results. And so, it's something, if someone's asymptomatic and they're just going to, to see what it's about, or to be, extra cautious and to get out there and get tested to have some peace of mind. But if results are taking a while to get back, it's important for the education to happen at the testing site as well, or, before, out in the community before a person goes to get a test, about the fact that, you shouldn't wait to act until your test results come back. And that you should take the precautions that you would if you were positive at that point.
Yeah, switching that mindset, because I agree with Norman. Doing a test and getting a result back in a week plus it literally becomes useless. I mean, it's just, what are we doing? Is it better to put all our resources just on symptomatic cases and finding those patients that are willing to work through the system and just trace from there? It's a real shame. It's, we're trying to fight really on a statewide basis. There's a couple new labs that are popping up to take some of the tests, but Quest has just had a real problem on a national basis, and it's difficult. And then, in Norwalk, the situation in Norwalk where they have a different lab that's not sanctioned by the state, that's very difficult. They're not, they're getting great results, turnaround times of, 24 to 48 hours, that's something you can work on. It hasn't been easy.
I know, and you're right. Like, we're very fortunate that Norwalk Hospital's lab, New Vance, the lab they use, is able to turn around so quickly.
Yeah, but they're moving off that, unfortunately. So. I think it's hard to switch the mindset of the public, to really worry about, here are the things that you should be looking for, and it's basically framing that patient that is symptomatic, and what does that mean and what you need to do, and just fine, you can test because somebody says you have to test, but it's not gaining what we want it to gain. So
it's almost like, at the beginning of this, when the testing wasn't available, we were doing it based on symptoms.
Right.
When we had widespread community transmission, if you have those symptoms, you just have to assume it's COVID, because that's where we were.
And we're back there.
All right. Anything else, guys, related to COVID?
just had one question, Deanna. Thank you for sending the Newark Public Schools reopening plan. I appreciated seeing that. I do have a question though. What is the health department's role in how that's all going to work if they get some cases and they have to enact, the plan? And my second question is, what is the, they say there's a plan for minimum and moderate spread. Like what does that mean? Like, what's the definition, or are we making that up as we go?
That is an excellent question, Terry. Both questions are excellent. The second one is we're waiting for the state health department to provide that guidance to define what that means. I believe they're waiting until August to define that. So it's close enough to the reopening. So I'm hoping that we'll get that soon, but we don't know for sure what that's going to mean for Connecticut. But yeah, we've been asking that same question. The first question is about what's the health department. Oh, sorry, what, Terry?
Plan.
The first question was about the health department's role. So really, Dr. Weinberger, as the medical advisor, and myself, they've been calling us for guidance and advice on particular situations and on, so we're really there as an advisory to help them make their decisions when it's needed. And then in terms of, if there's a positive case, or where does the health department, the schools are the ones that can do, notifications, but really when it comes to contact tracing, that's then when we'll pick that up. The in-depth contact tracing will be our responsibility as a health department for any residents of Norwalk. So, Darlene and we work really closely with the school nurses on specific situations. So Norman, I don't know if you have anything to add to that, but really it's to help advise them and guide them.
That's exactly what it is. We've had a couple cases, and we have had discussions with the school people, basically through the nurses, and that's worked out pretty well. Mm-hmm. And I think because they've been open over the summer, we've had a little taste about what it's going to be like over the winter.
So if a decision has to be made to close a classroom or a wing or a school, does that fall with the principal and the superintendent, or how does that work?
It falls with the superintendent, but the principal obviously is involved, as well as, Norman and I are also involved in those discussions.
Okay.
Anything else?
Deanna, do you have any idea when the office that you folks will be reopening any of your offices? Any word on that?
For the health department?
Yeah.
So that was actually going to be the next thing I wanted to talk about, just to close up.
Great.
So Darlene has put together a reopening plan for the clinical services, and so we're still finalizing it, but we're looking at starting to reopen for limited for a sexual health clinic, appointment only, staggered appointments. That will be the first clinical service that we want to reopen, as well as latent TB treatment, because we do have some people that need treatment, but the state also wants to see our reopening plan before they give us the medication for that. So really, they haven't been giving the medication for latent TB treatment. They've put a hold on that. So those are the first two things that we're working on. I can send you the plan if you'd like to see it. And
sure, that'd be great. I was just curious.
Okay, yeah. So that's what we're thinking first, is a sexual health clinic, making sure that we're able to treat those or see those who need the service, and then latent TB infection. And then after that, we're looking at those who are like adult immunizations, those who need to complete their series. There's still vaccines that are left. That's the next thing. And for childhood vaccine right now, we're really connecting them to the community health centers, like Norwalk Community Health Center and Day Street Community Health Center, for vaccines.
Deanna, did you say that the state is withholding medication on TB treatment?
They've been giving it for active cases, but for while we've in the middle of the pandemic, we haven't been doing the latent TB treatment. And so they're going to give it to us. They just want to see our reopening plan first.
I was hoping that we weren't talking. I hadn't heard of any.
No, not active. No.
Going on, and I'm like, wait a minute, what's going on?
Sorry. No. Sorry. No. Yeah, active TB. They'll give you the medication for sure. All right. Anything
And how
else?
about, I mean, how about staff coming back in? Or are you guys,
So we're rocking and rolling as we have been. Some staff are continuing to work remotely if they can. So some like the health education functions, others that can work remotely are working remotely. But you know, our sanitarians and inspectors, they're here, they're working. We're staggering start times to, you know, stagger people out, and they're out in the field a lot. So they've been here. So a lot of us have been here. WIC staff, they're still seeing clients remotely, but several of them are in the office working. So trying to think of any other, we're like, if someone can work remotely and they're able to do it successfully, we want to support them in that. And then if they're needed here, we need to be here.
what percentage of the workforce is working from home?
So I guess I would like to break that down into full-time versus part-time. Trying to think what the percentage would be. So most of us are here. Maybe 70% are here at different times, 30% remote.
Okay.
Does that sound right, Teresa, Megan? A lot of the people that are working remote are also like part-time grant employees as well. So they weren't, you know, not full-time workers. But most full-time workers are here. And we're also trying to do be here 4 days, work remote 1 day. We're doing some of that as well.
Yeah, that's probably how we'll do our, I mean, you know, our office is all administrative, and we're just starting to come back in now, you know, doing it the 1 or 2 day a week type of a program.
Mm-hmm. Yeah, I've been here most days. Yeah, so that's like when I talk about reopening, it's like, I've been here the whole time.
I'm there with you, Deanna.
Yeah.
I think that's actually
Like
something that
reopening.
I think the public doesn't realize that, you know, and that goes for City Hall as well, that, you know, these buildings were closed to the public, but there are a lot of staff that are working more now than they have, you know, in a long time. So when I say that, when people say, when are people going to start going into the health department? I was like, well, you know, staff is there now, and they have been since the beginning. So, and I think that goes, you know, that goes for staff over at City Hall as well, too, a lot of those folks. So I think that's something the public doesn't realize, that when we're closed, we're not really, it doesn't mean that people aren't putting in their hours. It's an interesting time, but it's so, I don't want to say comforting, but it's so wonderful to see how hard the team is working, and to see that everything is still happening. You know, that we, you know, Deanna has helped us all find a way to make it work, and to keep our functions going. So
So do you guys do face-to-face meetings, or do you Zoom while you're in the building?
We Zoom when we're in the building. We started off having daily supervise, like communication is really important to me. And I think, you know, staying on top of things. So we had daily conference calls, you know, and then it changed like to twice a week, and now it's once a week with supervisors. But yeah, they're all by phone or they're on Zoom. It's really funny. Me and two staff members met in the conference room the other day, like separate corners of the room. We all had our masks on, you know, so that was like one time we tried to meet in person, but that was it. Everything else has been, you know, on phones. It's funny, like we have to shut doors because the other person's like in the other, you know,
Across the hall.
because we're on the phone. Yeah.
Yeah, so we're running into those situations as we begin that process on the other side. Do you stay with purely Zoom and, you know, keep those conference room doors almost closed, you know, and except if one person wants to be in there to, you know, so it's you know, it's spraying down every day and making sure you're disinfecting all the potential and other people coming and going, FedEx employees, all those types of things that are still part of normal business. In our environment, we have people coming in and out of the building, and now we can't do that anymore, you know, so it's leaving packages outside, making sure they're connected, you know, so it's a whole bunch of policies, you know.
Yeah, we have a Dropbox outside for with clients who want to drop off their documents to us, even if they have any technological issues. So yeah, like trying to make sure we can accommodate people, but then also protect people.
Yeah, it's tough when you're a public entity. It's anybody can mess with that policy. You know, it's. Well, appreciate all the work you guys do. I'll tell you, it's you know, when if 6 months ago somebody told you what you'd be doing today, you'd go, you're out of your nut. You're crazy. We couldn't be doing that much work, you know.
Yeah.
And so varied, and it certainly is a public health time frame to really try to again educate the public on what the trying to protect themselves, you know. So yeah, I think that Diane has a good bringing it back to where we started all this stuff. You know, we should have a plan on how to be innovative with moving this from a demand type of a world to a more accepting. And if you guys can get free time, I think the idea of putting figureheads on a label, whether it's sports figureheads or educators or what it may be, I think that's a great way to open that door into positive versus the negative connotation of, oh, you have to wear a mask versus, hey, you get to wear a mask, so.
And actually, if I could just, one thing that I found has been that I'm seeing as a trend, especially in our area, in our state, and also locally, is this idea that to commend folks for the job that has been done already, and to suggest that, like, we're doing a great job, let's keep it up. And I think that I'm seeing a lot of pride when the mayor's reports come out and they see low numbers. I'm seeing a lot of people, acknowledging that, like, we're doing this, let's keep it up, let's not waste all this hard work, right? That we've, it is true, it's exhausting, but I do see the sense of pride in our community. And I think maybe capitalizing on that as well, to say, like, we're the A students right now, knock on wood, let's keep it up. And I think that will be helpful as well. And I think that gets to your point, Ken, of wanting, people wanting to keep up this great record that we have so far. So I think that'll be a focus of some of our communications moving forward as well.
Yeah, maybe you turn the whole thing into a contest, how to stay number one. It's not an easy thing to do. It's easier to slip back than it is to stay there. Everybody's gunning for you. Maybe you can turn it into a national program and we can take credit for it. Got to compete against a state who's number two and number three. Let's get them going.
All you need is some leadership.
That's true. It's true. Hard to find sometimes right now. It's so inconsistent at that level.
Well, thank you all so much. Thank you for your time. Thank you for your guidance and advice, as always. Really appreciate all your feedback. And thank you for all you're doing, in your own lives and your own jobs, for everything that you're doing to, help the community through this. You all are leaders. You're great examples of leaders.
And as always, it's great to see you.
Yes, it's great to see you too. At some point, maybe next year we'll do this in person again. I don't know, we'll see. But yeah, it's great to see you guys.
Have a good day, everybody.
Take care.
Stay well. Bye.
Stay safe.
Plug you in.